What if you were slowly losing your vision and had no idea it was happening? No pain, no dramatic warning, no sudden blur that sends you rushing to the doctor, just quiet, gradual damage happening in the background. Welcome back to Eye Health Insights. I'm Dr. Joseph King, and today we're talking about glaucoma, one of the leading causes of preventable blindness worldwide, often called the silent thief of sight. Here's what we'll cover today. I'll explain what glaucoma actually is, why it happens, who's at risk, how we detect it, and what treatment really looks like in 2026, because it's far more manageable than many people imagine. Let's start with what glaucoma truly is. Glaucoma isn't one single disease. It's a group of conditions that damage the optic nerve, and that nerve is absolutely essential for vision. Think of your optic nerve like a high-speed cable connecting your eye to your brain. Your eye captures light, but it's the optic nerve that transmits the visual information so your brain can interpret what you're seeing. If that cable becomes damaged, the signal weakens. And unlike a muscle or skin, nerve tissue doesn't regenerate. Once those fibers are lost, we can't restore them. In many cases, glaucoma is related to pressure inside the eye. Your eye constantly produces a clear fluid that nourishes its internal structures. That fluid drains through a microscopic drainage system located at the front of the eye. Under normal circumstances, fluid production and drainage are balanced and pressure stays in the healthy range. But if that drainage system becomes inefficient, fluid builds up, pressure rises, and over time, that pressure can damage the delicate optic nerve fibers. The most common type is called open-angle glaucoma, and despite the name sounding complicated, it simply means the drainage angle is open, but it's not functioning properly. Pressure increases slowly, painlessly. Vision loss usually begins in the peripheral vision, your side vision, not straight ahead, so you might still read clearly, you might still drive comfortably, and you might feel and see what you perceive to be completely normal. Meanwhile, small blind spots are forming in your side vision. The tricky part is that your brain compensates. It fills in the missing areas. So early glaucoma often goes completely unnoticed. That's why routine eye exams matter so much. There's another type called angle closure glaucoma. This form is less common, but much more dramatic. The drainage angle suddenly becomes blocked. Pressure rises quickly. Symptoms can include severe eye pain, headache, nausea, blurred vision, and seeing halos around lights. This is an emergency, and fortunately, it's much less common than open-angle glaucoma. Now let's talk about who's at risk. Age is one factor. Glaucoma becomes more common after age 60, but I've diagnosed it in patients in their 30s, 40s, and 50s as well. Family history is one of the strongest risk factors. If a parent or sibling has glaucoma, your risk increases significantly. And many patients don't realize a relative had it until we start asking questions. Certain medical conditions like diabetes and high blood pressure may increase the risk of glaucoma. People who are very nearsighted are more susceptible, and individuals of African, Hispanic, or Asian descent have higher rates of certain types of glaucoma. But here's something important. Eye pressure alone does not determine whether you have glaucoma. Some people have elevated pressure for years and never develop optic nerve damage. Others develop glaucoma with what we consider to be normal pressure levels. That's why diagnosis is never based on a single number. During a comprehensive eye exam, we measure eye pressure, but we also examine the optic nerve carefully. We take detailed imaging scans that measure the thickness of the nerve fibers, and we perform visual field testing to map out your side vision. Often, I'll diagnose early glaucoma in someone who feels completely fine, and honestly, that's the best time to catch it. Once optic nerve fibers are lost, we can't bring them back, but we can absolutely slow and often stop further damage. The goal of glaucoma treatment is simple: lower the eye pressure to protect the optic nerve. Most commonly, we start with medicated eye drops. These drops either reduce fluid production or improve drainage. For many patients, drops alone are very effective. Some patients worry about using drops long term, and yes, glaucoma typically is a lifelong condition. But think of it like managing your blood pressure. It becomes part of your routine. And that small daily step protects something incredibly important. In some cases, we recommend laser treatment. Laser therapy for glaucoma helps improve the eye's natural drainage system. It's done in the office, and it takes only a few minutes. And many patients are surprised with how easy and straightforward it is. For more advanced cases, minimally invasive glaucoma procedures can create new drainage pathways. Modern surgical techniques are much gentler and more refined than they were decades ago. I often hear patients ask, "Am I going to go blind?" And I want to answer that clearly. Early detection and consistent treatment, the vast majority of people with glaucoma maintain functional vision throughout their entire lifetime. Severe vision loss usually happens when glaucoma goes undetected or untreated for many years. The key is consistency, regular follow-up visits, repeat testing, and taking medication as prescribed. Glaucoma management truly is a partnership. And I want to pause for a moment on the emotional side of this. When someone hears the word glaucoma, there's often immediate fear. Vision is deeply personal. It affects independence, driving, reading, recognizing faces. But fear usually comes from uncertainty. When we replace uncertainty with understanding, glaucoma becomes far less overwhelming. It's common, it's well studied, and we have excellent tools to monitor it, and we have highly effective ways to control it. If you're over 40 and you haven't had a comprehensive eye exam recently, this is your gentle reminder. If you have a family history, it's even more important. And if something just feels different, maybe your side vision isn't as strong or dim lighting feels harder than it used to, trust that instinct. A simple eye exam can provide clarity and sometimes reassurance. If you're noticing changes in your vision, a simple eye exam can help. Thank you for watching Eye Health Insights. Take care and see you soon.